Thank you for joining us for the sixth and final session of the Chiropractic Workshop Week. My name is Stephen Glass, and I'm an admissions advisor for the Doctor of Chiropractic program. In this session, you will be hearing, we'll hear from alum Dr. Montserrat Andres, Dr. Ali Masumi, Dr. Joe Edens, and current students Alex Pham and Kristen Hurdy. They will be speaking about the clinic experience at UWS, their clinic work in the real world, how they chose UWS, and highlights of their experience in the program. This is a Q&A session, so please don't hesitate to post your questions in the Q&A box. It is my pleasure to welcome our panel of current students and alumni. So to start, it would be great to have each of you introduce yourself, indicate where you're from, what quarter you're in, or when you graduated. Maybe let's start with Dr. Masumi. Oh, we can't hear you.
Can you hear me now?
Yes, we can. Perfect. Thank you.
So my name is Ali Masumi. I am from Vancouver. I graduated with my doctorate degree in 2010 and worked for a few more years and went back, did my master's degree in sports medicine. So after a couple of years, came back and I started my fellowship, which is a 4-year program in sports specialist, basic fellowship in sports chiropractic in Canada. So I just recently finished that one as well. So that's altogether about 14 years of school, in case you're calculating. I have a practice in downtown Vancouver. It's called Kinematic Sports Medicine. It's a multidisciplinary clinic. We have physiotherapists, sports medicine physicians, medical doctors, acupuncturists, kinesiologists, chiropractors. It's been almost I'm into my second year. So it was a COVID business and it is growing, but it's a little bit tougher than anticipated originally. I have been working with a lot of different professionals and semi-professional teams. I work with the UBC hockey team, baseball teams, and World Juniors, done with Whitecaps, which is a professional soccer team in Vancouver. And last year, I was actually the first chiropractor that joined the Faculty of Medicine at UBC. So I teach medical students, sports medicine, and musculoskeletal health. So I work at a hospital and basically run their MSK lab, which is it's awesome. It's a great privilege, but it's also a very big step for the profession, I think. Other than that, I think I'm ready for any questions. I'll say it as is. I won't, I'll say exactly what's on my mind. And anyone from Canada, from Vancouver, if would love to come down and go for a coffee, ask questions, and I'm always available. So,
fantastic, thank you, Dr. Andres.
Hello, everyone. My name is Montserrat, and I am also a sports chiropractor, and I treat a little bit of a different population. I am a dancer. I have been in theater and dance my whole life, and so now the majority of the people that I treat or that I specialize my sports medicine practice in is in performing artists, musicians, dancers, contortionists, circus, and because I do a lot of circus, and because I worked at a place called Evolution Healthcare and Fitness here in Portland that specialized in a lot of climbers and mountaineers, then I also do a lot of climbing and mountaineer injuries as well. But I think a lot of the circus folks that I have worked with and treated have really informed a lot of my hanging athlete work. I graduated in 2013, and I recently, I also opened a COVID practice. I don't know, we must be a little bit touched in the head, I think. But the focus of my practice is also an interdisciplinary space. We currently have acupuncture, massage, occupational therapy, specializing in pelvic floor. We're adding social work, specializing in helping families with trans youth navigate services and mental health. And yeah, and we're adding a few other providers as well. But in the midst of doing all the sports medicine work that I do and the other work people do, we center the queer, trans, and BIPOC community, creating safe spaces for them to be treated. And so, yeah, I'm happy to answer any questions about the madness of opening a business during this time as well. Any of the population or work that I do. And I am also the newest board member on the UWS Board of Trustees.
Very cool. Thank you. Dr. Edens. Oh, you're muted there, Dr. Edens.
Hi, everybody. I'm Dr. Joe Edens. I graduated December 2020. So very anticlimactic ending to the program, but I made it. I'm currently working as an associate. I've been out for about almost a year and a half now. I've had 2 different jobs. You learn after you sign that first contract what to do and what not to do. So I definitely want to help with answering any questions related to becoming an associate after school, because that is generally an in-between step for a lot of people. I am Canadian. I'm from a small town, Alberta. I live in America. I actually met my wife day 1 at chiropractic school. So she is American. We live here in Portland currently, and she's also an associate. We are in the planning of opening a business, so just kind of putting together a business plan right now. But yeah, I'm here to answer any of those questions, any visa questions too. I went through that process, which is a process, but you can do it and is achievable. Okay. Thanks.
Thank you, Dr. Edens. Kristen.
Hi, everyone. My name is Kristen. I am a current Q7 student in the chiropractic program. I'm also a student ambassador. I am also Canadian. I am from Regina, Saskatchewan. I did my undergrad degree in kinesiology at the University of Regina. So I know that's not the only route you can take, but it's a pretty common one. And yeah, that's about all.
Thank you. And Alex.
Hey there, everybody. Like Kristen, I'm also a quarter 7. We're actually in cohorts. So, hi, Kristen. I did my undergraduate at Western Washington University, got my bachelor's of kinesiology there. I went to University of Arkansas, where I got my master's of athletic training. So I worked with their football team, and I worked with Texas A&M's football team, and that was fun. And I decided, why not be a career student? And so I went back to school at UWS, and loving every second of it.
Thank you, Alex. So as a reminder, this is a Q&A session. So if you have any questions, anything that you're curious about, don't hesitate to ask a question in the Q&A box. I guess I'll start out. I'll start out easy and sort of, I guess, predictable. Kind of going way back. What inspired? And we could just round robin this, or if someone has something they want to say, just jump right in. But let's start out with what inspired you to pursue chiropractic, and how did you land at UWS? Does anyone want to share?
I can start. It's so when I was in SFU, I did my bachelor's degree as well there in kinesiology, and I was playing for the soccer team, and our team doctor was a chiropractor. So that's how I got exposed to it, and went and learned about it a little bit. And I always loved that sports medicine aspect of it. So that was always my my goal. And currently my practice, which is a little weird, but probably only 30% of my patients are mechanical back and neck pain. The rest are extremities and shoulders and knees and elbows and whatnot. So and the reason for Western States was 2 reasons. One is probably it's one of the most evidence-based school in North America, and that was my ultimate goal. I'm very evidence-based. I'm very patient-centered practitioner. So it was between Western States and Toronto to me more than anything else. And just living in Vancouver, it was easy for me to choose Portland, and would come back on every long weekend, or once every couple of months, and never missed a friend's birthday. So that was another great reason, and that was my reason basically for picking Western States.
Ah, fantastic. Anyone else?
I can talk on this. So I agree with the evidence-based. It was definitely really important because, as we know, the chiropractic profession has a vast majority of styles of treatment. So that was a big reason that I went to Western States. Also, similar location. I actually went to undergrad in South Carolina. And so I was tired of being so far away from home. So I came back to the West Coast, and also out of the three that there was, now Palmer West is closing, but out of the three that there were, Portland was the cheapest option to live in as well. So that was another push to come to Portland versus LA or San Diego or San Jose.
Thank you. Looks like we have a question here. This is a good one. What should I do to prepare for chiropractic school?
I can give that a try. I think you just have to be really ready on all levels. I think very different from if you haven't been in either a master's or PhD level program, or if you haven't, kind of pursued another profession that vigorously. This type of program is very different than an undergrad program. Like, it really requires you to center exactly why you're there. If you just kind of think you need to be in school, and if you just kind of think you want to do chiropractic, you're not going to make it. And I want to be really honest about that, because when you are studying and when you're in classes all day and then you have to go home and study for 5 hours, you have to be very, very centered about why you're there, so that you remember that in those moments. Because if you're just kind of flailing and you don't have a good central access around that, then it's too much to kind of go uphill against without a reason for doing it. And so I would say, for a lot of people, making sure that you're mentally ready, physically ready, economically ready to take on these challenges, because any outside stressors add an exponential amount of stress, whereas before those stressors may have been just kind of slight annoyances. Once you're in a program like this, it is so demanding of every element of your being. You're being physically touched, you're physically being active, you are being lectured at, then you're actively learning. Every part of you is being stimulated. And so if you have kind of these additional stressors that come in from all sides, and you don't have a good reason for wanting to be there, it can be a little bit much. And I saw with at least some of my classmates, they were the folks that I felt struggled the most in the program.
I want to piggyback on that a little bit and answer the question about the expectations of school, your pre-expectations, and then if there was any surprises or disappointments. So I was definitely surprised with how much you learn as a doctor of chiropractic medicine. I did not think that you would learn so much, but when you go to medical school and chiropractic school, the first year is the same. And it's a whole bunch of basic science stuff. It doesn't generally apply to too much of chiropractic school, but you have to learn to be a doctor. But going through that first year was very much like, wow, I didn't know, one, that chiropractors had this type of knowledge, and two, that I could put all this knowledge in my brain. So that was definitely a big surprise. I think the biggest disappointment, I finished school with COVID, so that was a big disappointment near the end. But otherwise, I don't think there was too many disappointments. UWS does a really good job of prepping you, being realistic about what to expect. And you'll never find a student or an alumni that won't tell you straight up that it is hard. And that if you're not prepared for it and this is not what you want to do, it's not worth your time, energy, or money, because it is difficult. So definitely be committed. And any shock or disappointment that comes, everybody gets disappointed at some point, but it's generally because you're overstressed and it's over something super minor. Overall, there's been no disappointments of it.
Great. That's a very thoughtful answer. For those of, I'm not sure if all the attendees could see the question, but the question is to any panelist who's most inclined to answer, how have your pre-Cairo school expectations and ideas of being a chiropractor aligned with your now reality of being a chiropractor? Any major surprises or disappointments? And I think both of those answers really kind of touched on that. Thank you. Any other, anything else you'd like to add to that, Dr. Masumi? Nope, you're muted or can't hear you there again.
Can you hear me now?
Yes.
Yeah. I think one big thing is for me is as you're picking a profession, make sure you go and observe chiropractors and put that time into and understand who you're going to be, right? In 4 years, I think that's the biggest thing. It's see different types of chiropractors. There's going to be some crazy ones. There's going to be some good ones, like any other profession. And maybe if you have a more realistic approach and understanding of who you're going to be in 4 years, it would probably make things a little bit easier. But I haven't had any specific disappointments or anything after graduation. And one big thing was it took me some time, maybe like a few months up to a year, to build my practice up and start living a life I'm living right now. So it is, you need to get out there, you need to promote yourself, you need to put the hours. It's not like just because you're a doctor, you get out and, make $100,000 or $200,000 a year, right? So, but it is doable, it's, I'm an example, but I worked hard for it. So just when you're done with school, it doesn't mean you are set to start your new life. It's just you're beginning your new adventure, I think. So, but I think observations is a key.
And maybe one more question for our alumni here. What's been a challenge as a chiropractor besides COVID?
It is a taxing job physically. If you are in, you're working with patients all day, physically and mentally, you have to put your doctor face on, have your doctor brain. And so mentally, if you're having a tough day, it doesn't matter. You got a day of patience. If you're, if you worked out leg day and you're sore, doesn't matter. You have patience. So, you kind of, my mentor, my boss right now, he was talking to me. He's like, you're an actor. You truly are. When you go in there, you are putting on that game face, and what's happening in your personal life or at home, whatever, that doesn't matter, because your patient in front of you is what matters. And so there is, I feel like for my wife and I both, it took about 3 months for imposter syndrome to go away and to really step into the shoes of being a doctor and realizing like you have patients that are relying on the knowledge you're giving them and trust you wholeheartedly with nothing. They just trust you with everything. And you go from being a student of like having this safety net in the clinic and having all of this assistance to, all right, you're done, you're a doctor, and you're given all the knowledge, but now you have to step up to the plate. And for us, it took about 3 months, I'd say. But that is definitely one of the big things and one of the challenges when you initially get out of school.
Thank you.
Yeah, I would like to add that especially coming out as a new doctor, and I think Dr. Edens, you referred to this slightly at the beginning of your conversation earlier, is that I think because you have been in an academic program where you're receiving about 7 hours of new information a day, and it seems like that information of 7 hours of information a day could be endless. Like even when you're at the end of the program, you're like, how can I still be learning new things this much, right? That it's really easy for us to go into the field and feel like we're not quite ready and we're not prepared and we don't know our value. And I would like to say that at the end of your education, you're extremely valuable. You're extremely valuable to your patients. You're extremely valuable to any practice that you become a part of. And one of the things that I have seen that's been really disappointing is that there are a lot of senior or elder doctors that take advantage of that misconception that you don't know what you're doing and take advantage in contract times of a lot of young up and coming doctors. And so I would say definitely have somebody that's been in the field look over your contracts and have them really fight for you, because I've seen so many people getting ready to sign a contract that was going to really exploit them. And I think that that's been a very challenging for me to know about our profession, that we do this to ourselves. We should value each other. And so I really, for any of you that go in and go through this program, just know that when you come out, you are an asset to the places that you join and the people that you treat. It doesn't mean that you don't still have a lot to learn. It doesn't mean that you don't need to continue to develop professionally, but you are already coming out with a tool set that is incredibly valued by your community. And then if you're planning on going on later, at the beginning, further, whenever, to start your own practice, I will say that probably the biggest challenge and the surprise of my life has been insurance in the United States. Insurance companies are scoundrels, and it's a very, very challenging system to try to figure out on your own. So I would say get mentorship, get people to help support you, talk to other providers about how they're navigating it. Because I think for me, that has been the biggest challenge as I've started my clinic here in Portland.
Thank you.
Mm-hmm.
How about maybe, Kristen, you can manage to start with this one. We have 3 Canadians on the panel here, so some input will be good with this. Any tips for Canadian students moving to the US? It's pretty broad, but.
So I think the biggest thing for me, especially before I moved here, was just getting all of my visas and all my paperwork in order. I had no idea where to start with any of that. I think the best thing you can do is reach out to Natasha French about that. She knows absolutely everything there is to know about it, and she eases stresses about that a lot. So I would reach out to her and make sure you just, even if you just send her, if you think you have everything done, just send it to her, get her to check off on it, make sure you have everything so you don't end up at the border and get turned away, and keep it all together. I think when it comes to loans, just make sure that you know that there's going to be the conversion from Canadian to American. Get an American credit card, whether that's through your Canadian bank, so that it's in US dollars. Otherwise, you will be charged a fee every time you use your Canadian card down here. Phone plans. I got one that it's not long distance either in Canada or America. There are ones that work both ways. I think that's really useful because if you go home for break or anything like that, if you have an American plan, you will be charged when you're in Canada. Yeah, does anyone else have anything to add to that that's Canadian?
I'll add to that one. So you're definitely going to travel with a little booklet of all your stuff, back and forth everywhere you go. Even when I travel like in the States, but like across, like if I'm flying even in the States, that packet's with me, not risking it. With items, when you move here, depending how far you're going, things can be, if you're trying to buy used stuff, it's not terrible here. So if you're looking at bringing a U-Haul down versus for like this massive couch that you have, if you don't care about aesthetics, you can pick up a cheap one here. It's not worth the whole lot of that. For apartment hunting, this one blew my socks off when I was moving here. I asked Natasha, who's a very valuable person, where should I live? Where should I avoid? And she gave me, there's not a specific area. It's really just parts of streets. And I was like, what? How does that make any sense? But in Portland, you can have one street that goes all the way from over here to here. And this part may be bad, but this part may be awesome. So when you're apartment hunting, don't feel bad about reaching out to your advisor about, hey, I'm looking at this apartment. What do you think? Definitely utilize, if you decide to come to UWS and are committed, you get put in a Facebook group with all your classmates, which is super helpful. You can find roommates that way. Just start talking to people. I actually came to school 2 weeks before classes started. And so there's a bunch of us that were earlier. So in that Facebook group, we just said, hey, let's all meet up for coffee. And so there was about 12 of us that met up 2 weeks before school, just to kind of get the jitters out and say hi to everybody. And so that was really cool to do that. I would not move last minute because things do happen at the border. And it's better to be settled before starting school, because it's not like undergrad where your first week's superficial. It was like you did your welcome day, and then your class started the next day, and that was it. Dive in deep, you're in it, go time. So mentally be prepared before you start, for sure.
Thank you. That's all a great advice. Just on a quick side note, I'll have a slide up as we're finishing things out that'll have Natasha French's contact information on there, as well as mine. I'm happy to answer any questions you have about Portland, the area, or the like. So let's see here. We do have, I have a question that maybe Alex, you want to take on. It says, what can you say about the support you're receiving from the faculty and the university as a whole?
Yeah, definitely. I think it was mentioned earlier that, the academics are a bit hard, especially when you get hit with 20 plus credits a quarter. So you learn immediately what kind of student you are, and maybe it's not working for you right then. And so I definitely ran into that, my first quarter, my second quarter, and each time I reached out to our student services department, and they, we talked about it, and they walked me through things such as like, well, here are some study habits you can try, or here's some study techniques you can try. And so I think that was one of the great resources we've had there as well. Currently, as my time as ASB president, there's a lot of, background stuff that people don't realize that goes around with, running this whole chiropractic school. Our librarians are incredibly amazing, especially when students are needing help looking for, whether it's resources to study for boards. I know I've been there. I remember when I took part 1 boards, I was freaking out. I was like, I have no idea what's on biochemistry, like at all. And they're like, here are all these fantastic resources on like the boards and how to prep yourself. And so that was fantastic. And also the upper quarter students as well have been, amazingly helpful. Like when we go into clinic to receive our complimentary treatments from the upper quarters, they're more than helpful. Like, hey, like, we've been there. Like we've been in, spinal disorder classes with Dr. LaFay. They're very hard, but here's what we did. And, here's how we've like succeeded through it. So I think all the way from the administration and into the students itself, the support system is there. And I think everyone can agree that your time there, you just have to be humble and recognize like your weaknesses and reach out for help, because people are there to help. You just have to ask, because sometimes they don't know you need help.
Fantastic, thank you. This one's an interesting question. Have you dealt with patients or other doctors who talk to you about the more vitalistic side of the profession? I don't know if anyone can speak to that, or
I can start.
Okay.
Again, the caveat is I work with the Faculty of Medicine at UBC, so I am, if there's a spectrum, I'm very far to the one end, the medical part of the profession. So, I mean, we can talk about this for years almost, but there is that aspect of our profession for sure. And I have had family doctors that I used to work with, and I still do, because I used to work in a medical clinic, ask me. And the best thing is, I always say and again, don't take this the way I say it, because I think it's better if you're somewhere in the middle and you understand and appreciate everybody and kind of work together as a profession. I'm just a little bit of a hothead, so please don't take this advice literally. But for me, is I just tell them, don't go and see them anymore, just because I feel like they are hurting us as a profession. They don't represent me and my profession. But again, understand that this is probably not the best answer, but it's good to be somewhere a little bit more in the middle. I understand my flaws, and that's probably one of my flaws, but I've had to fight really hard for the profession in BC. So that's a very touchy subject to me.
Thank you for taking that one on. So I guess overall, this probably more for the alumni here. How did the clinical experience of the program translate to working full-time as a chiropractic physician? I know it's always going to be a tough transition, but you feel like you were prepared?
Yeah, I mean, oh, sorry. Do you want to
No,
go?
you go for it. You go for it.
So I worked, of course, in the student clinic and then moved on to a preceptorship before being in practice. And I felt the cases that I was working on absolutely prepared me to be out and treating. And the guidance that I got from my preceptor doctor and from my attending clinicians was incredible. And I would say the biggest thing that is good to move into gradually, so I wouldn't necessarily say that I think it should be different, but the volume is very different depending on the kind of practice that you're going to be working in. I definitely have always worked in practices where I have a lot of time with my patients. And that's the type of work that I enjoy doing. I like to be able to, I would prefer to have more time in a session with people and then treat them for a shorter amount of time because we're able to address the issues more completely faster than to have short appointment times for a really long haul. But I would say that that would be probably the thing that was most challenging. My schedule filled up extremely fast when I started working. So I went, I think in my first week I had 20 patients, and then it just like skyrocketed after that. And I was like fully booked within a month and a half. And that takes a lot of energy and stamina. And yeah, that was a little rough.
Thank you. Let's see, maybe this would be for our current students. Are classes are classes still online or in person? I mean, I can address that, but being that both of you are in the program.
Yeah, so right now, all labs are in person. There are some lecture classes being done in person, but you're always going to have a couple that are asynchronous that you do online. So you will always have a couple classes that are completely online, and your lectures will just be posted and you just watch those on your own time. But right now we do have all labs in person, and then our lecture classes that are normally in person are in person as well right now.
Fantastic, thank you. Let's see, here's a good question. Did you feel like UWS prepared you to open or operate your own business, or was this something you learned after graduation? I guess for those.
So I'll touch on this because I know our professor now was a lot different than the professor before. The professor who teaches business right now is actually one of my best friends now, mine and my wife's, because my wife works in his clinic. But he was awesome. Now that I'm building my own business plan, I'm just going through slide by slide, and it was awesome. In school, however, it's definitely one of those classes that you're like, let me get through it, because it's not, unless you already know you're going to open an office right out of school. It's one of those classes that you want to take it in, but it's not the most important one at the moment. But now that I'm trying to build my business plan and get everything in order, I am going through it, and it is great. It is great to have that outline, that structure. I know there is a business club on campus, and at least through our class, most of the people who committed to that, because it was a 6 a.m. club, were the people who were planning to start practice either right out of school or within that first year. So you can definitely get more of that knowledge, but I feel like it's not a priority for a majority of students going through the program when it's taught. I hope that made sense.
Dr. Masumi or Dr. Andres, you want to add to that, or?
Sorry. Okay. I mean, I graduated in 2010, and the short answer to that would be no. I was not prepared to open up a clinic. I wasn't. I don't even think we had a class actually at that time, anything about business, or actually we had a smaller class, and I made everyone else do my work. So I didn't really participate so much in that class. But as Joel was saying, I think it's 100% accurate. It's it's something that's probably not a priority at that time. At least it wasn't for me. But and also it's a little different opening up a clinic in Canada, more specifically in BC. I think every province and probably every state has different rules and regulations, and it's really good for Canadians to have a mentor or have someone they can speak to about these things. Or sometimes, like say BC Chiropractic Association or Alberta, they might have some open houses, or sometimes we actually gather with some other UWS students. They come in, they get invited for dinners and whatnot. So it's really good to attend if you're Canadian, just kind of see, because practicing in Canada is really different than States. People were talking about insurance companies, and that's something that is really, really hard for them. We don't have to deal with that. For us, is really it's a fee. So if you see them for 15 minutes, it's $65, and that's really what that is you don't charge for different insurance. I mean, you do charge extended health insurances, but you don't have an ICD 10 or 11. I don't know what it is now in States, but we don't have to deal with those things. So it is different. It's quite different. I wasn't really prepared when I graduated, but I'm glad that Joe's saying there's actually a specific class in some clubs. And again, the point of Cairo school is not necessarily to teach you business, right? That's hopefully there's a part of it, and I understand that, but I don't think any other. I've talked to people in CMCC, and they say the same thing. They say they're never prepared when they graduate. So.
All right, thank you. This one kind of is maybe two-parted. There's a question here, but I also have a curiosity. Kind of has to do with like school life balance and how you find that. But the question specifically here is, has anyone gone through school with a significant other that was not also in Cairo school? If so, how was it balancing school, new friends, study groups with your significant other? So that, but also if you have something that you could offer up about just finding that balance, because it is a rigorous program, it would be great to hear.
Yeah, so my girlfriend, she's an athletic trainer as well, but she lives in Seattle, and I live here in Vancouver, Washington. So that's about a 3-hour drive, and I don't get to visit her as much as I want. And athletic trainers work insane hours, so neither she didn't get to come down here either. But I think with that, it's just a lot of communication and just knowing, like, prioritizing what you have to do, and really just letting them know, because school gets a lot. Again, there are some quarters where I think that peak quartered hours was 32 credit hours or something like that. So that's like 14 classes. And so part of it's definitely, again, just got to communicate, being honest with yourself and to your partner about, your needs, and, school is definitely going to be a big factor in that as well.
Mm-hmm.
We were given advice on day one of classes. We had 2 senior students, I think they're like quarter 10, came to talk to us, and they specifically said, relationships will end, marriages will end. And at the beginning, you had people who had come down with their partners, they're married or they're long-term partners, and you were like, there's no way. But near the end of school, it happened. Mm-hmm. So if you are coming with a partner, if you're doing long distance, it's different because you're setting up for long distance. And if you're late studying with a group, it's not like you're taking away from that partner time. But if you're bringing a partner here, the advice that we were given is create those boundaries and know the reason you guys are moving here, and have that discussion before it's even a talk about school, because there are going to be days that you will be in school at 7 a.m. and you will not leave the school till 8 or 9 p.m. So, and you're paying a lot of money. So that is a lot of the focus. So everybody was like, that's BS. It's not going to happen. It happened. So just be aware of it. That is something that does happen.
I'll also add to that. I was married when I went through the program. And then I had some friends that moved here, and one of the people in the couple was in the program. And what I ended up doing is that I would look at their schedule for the quarter, and I would let them know, week 4, you can have a weekend together. Week 7, just please, like, prepare meals for this person, like prepare a bath when they get home. you may not see them for a few nights. Like this week is going to be really, really rough for them. Be extra, extra kind and nice. Like if you have to bring up, a relationship issue, wait until after week 8, And so I would say, if you can talk to some students in the quarter right ahead of yours that have a good memory of what was going on, that can be really helpful. One, in knowing where the gaps of time are, where you could maybe do like a little weekend trip with somebody, or like a trip to the coast, or, like bonding time. But then also the weeks that it's going to be an absolute no-go for anything extracurricular. And I think that can really help a lot of that navigation, if you can plan ahead of time that way.
Yeah, that's great advice. And going through the program with my wife, so we met day 1, obviously not married day 1, but going through the program, even as we were building the relationship, and relationships do happen in school as well. There's this whole Valentine's post that the school does about couples, but going through school, a lot of people end up meeting their partners, and you still, even if that's you have to still balance, like, okay, this is school. Okay, let's shut our school brains off. Let's have some quality time. And it's no different if you have another partner. Like, you just have to dedicate that quality time, and you have to fill their tank as much as you can when you have room for that. And when you need your tank filled because you are on finals week and exhausted, you need to make sure that you are communicating that with your partner.
Any advice from maybe the current students who just to find a balance where, just if you have a weekend, do you study all weekend, or do you chisel out and ensure you have some time to yourself for your own mental health?
I like to make sure I at least make time for myself by scheduling out kind of when I'm going to get everything done, and set certain blocks of time. And during that time, I'm not doing any school. I'm trying not to think about school. I have things planned for my own personal enjoyment, whether that's just making sure I go to the gym every night or something like that, just things for yourself and for your own mental well-being that aren't studying. And even if you have to set an alarm, and when that alarm goes off, you're done. It doesn't matter if you didn't get what you wanted done. You just have to be okay with not always being in the position that you want to be in, because you are getting thrown a ton of information. You're not going to be on top of everything all the time. And the more you just continue to try be on top of things and not give yourself that mental break, the more you fall behind. So I think it's really important to, even if you have to schedule it out and just say, this day at these times is when I'm taking a break for myself, and really stick to that, I think is really important.
Fantastic. So I want to be cognizant of all of your time. We're kind of getting near what the allotted time, but there is a question here that I think might be worth answering. And then I also would like to see if each of you have some parting words of wisdom or advice that you might offer incoming students. But this question says, did you think about becoming a PT before choosing Cairo school? If so, why did you choose chiropractic? As an advisor, I hear that's sort of a very similar story from a lot of folks.
So I considered PT when I was probably a sophomore in school, in undergrad, but PT can be very glorified, in my opinion. You think about a PT, you think, oh, they're working with, athletes and all this, but a vast majority of PTs work with people recovering from surgeries. So it's not the glorified job. You're dealing with seniors, just typical ACL tears. And at the beginning, it can seem cool. But once you start working with things over and over, it becomes the same issue. People still come in, complain, and you're like, it's okay, because I've dealt with this multiple times. So that's what really deterred me from that. So my closest thing, I was between chiropractic school and dental school. Once I took the dollar signs away and realized who I truly was, I realized I was way too outgoing to be a dentist, and I wanted to have a career that people enjoyed coming to see me. So they came in with a smile and they left with a smile. It wasn't a burden on them, and they were happy. And since starting, it's been amazing. You can help people get better, even though, you know, you do muscle work and they absolutely hate it. They keep coming back and paying for it and they love you for it. So that has been a big reason of why I went the chiropractic route.
And during my last year at Arkansas, when I was working with the football team, I was looking into schoolings for actually PT school to go in because I knew I wanted to do more with my degree and my license. And I did a rotation with one of the chiropractors that came into our football team. And it was really interesting to watch him work with these, 300-pound offensive linemen. And, they come in with pain, like, oh man, this hurts. Like, I really need help. And then after, sessions with the chiropractor, they felt better. You saw them moving better. And so for me, I think there's a lot of overlap for sure between a physical therapist and a chiropractor, but the approaches are different. And for me, I wanted to be a chiropractor because you get that more hands-on experience with your patients and really, you're more connecting with them. And, for me, I did that whole rehab route before as an athletic trainer, and I kind of got bored of it. And so that's why I wanted to continue that chiropractic route, kind of like what Dr. Joe said.
All right, well, thank you. I guess, let's see here, just to finish things out, any, like I said, parting words of wisdom, advice for incoming folks?
I would say enjoy your time at Western States. Just enjoy it. It's things will be different when you graduate. Enjoy it. Make sure you pay attention to your financials, especially for the last few quarters. I ended up being a little bit short in money because I was buying shots for everyone when we go to the bars. So make sure you kind of pay attention to how much you spend. But enjoy your time. You'll find friends, colleagues. It's great, and it's a very satisfying profession.
I know a lot of this could seem very daunting and scary because we all talked very real about the profession and about school, but it is well worth it. And I would do it again. Not right now. I would not go back right now, but if I had to do it again to get here, I would do it again. So yeah, just know that it's what you want to do. Get your finances in order. If you're Canadian, get your visa in order and put your head down for the 3 years, get through it, because the light in the end of the tunnel is awesome. Very fulfilling.
Yeah, I will second that, or third, I guess at this point. One of the things that I heard over and over was when I was considering going to school and while I was a student, anytime another chiropractor found out that I was a chiropractic student, they were like, just hold on. We know it sucks. It's going to be amazing and you're going to love your life. And it's true. There's really nobody that I know that that I talk to that's in the profession that's like, this sucks. There's elements of a practice, of course, that you may want to be different, but like our lives are great. We do really important work in our community. We educate people. The reward that you get on the other side is huge compared to the time and investment that you put in to be able to serve a community. It is a beautiful experience on the other side. And again, as Joe said, I don't know that I am even ready now, almost 10 years out of graduating. It's rigorous, y'all. Like, bring a helmet, put on a seatbelt, but you can do anything once. And you're going to learn so much, and you're going to meet so many incredible people, and you will be exposed to some brilliant minds. UWS has some incredible faculty. And I think that was the thing that helped me really get through, is that I felt like I was in really great hands. Like, I didn't feel like my teachers were fumbly. I felt like the administration really cared about us. And so that support really helped carry me through. So I know it can be hard to make the decision to do something like this, but if what you want to do is go into chiropractic, I just would not even pause, just enroll, get in here. We'll be here on the other side when you're done.
I think one of our professors said to us, and it summed it up pretty well. The days are long and the weeks are super short. And so like for me, it's like, I think yesterday I was a quarter one and now all of a sudden I'm quarter seven, almost done. And so it's crazy to think like you do a lot of work, you learn a lot of things, and suddenly you're graduated and you're like, oh my God, I'm going to start practice now. And I think the other doctors can agree that, you know, there's a sense of immense amount of satisfaction you get from helping a patient and helping them, you know, achieve a goal that they didn't think was possible. But, you know, to get there, you kind of have to earn that by, you know, going through the school, the 12 quarters, and, you know, putting your hours at the clinic and then learning and learning. And so, you know, I'm in that process right now, and I hopefully one day I will earn that right when I graduate and get into clinic. But for now, like, you know, I'm a quarter seven, and I think part of it's just enjoying that process and really just, you know, not being afraid of the 32 credit hours that I mentioned.
All right. Well, I want to thank each of you for joining us and taking some time out of your evening. It's been really informative. Again, thank you so much. So I'm going to finish this up with just a screenshot of your admissions advisors for the Doctor of Chiropractic program here at the University of Western States. If you have any follow-up questions about program specifics, the admissions process, or we could even relay some questions to these folks if you are really inspired to want to ask them some more questions. So thank you very much, and you all have a great evening.